Is it true that cesarean section doesn't hurt? First of all, before the operation, the doctor will conduct a comprehensive assessment to determine the position and health of the fetus. Secondly, the mother must not eat or drink before the operation to prevent the risk of vomiting during the operation. Then the nurse inserts a catheter into the mother's body. The purpose is to ensure that the bladder is empty during the surgery. Once everything is normal, the pregnant woman can enter the operating room. The anesthesiologist will choose the most appropriate anesthesia according to the condition of the pregnant woman. Usually a 9-centimeter needle is inserted through the spinal space to inject anesthetic, so that the pregnant woman is half anesthetized and half awake. After the anesthesia takes effect, the doctor will thoroughly disinfect the pregnant woman's abdomen. Then the area is covered with sterile surgical towels. Then the actual surgery begins. First, the surgeon makes a horizontal incision of about 10 centimeters in the lower abdomen. But this layer doesn't remove the fetus. The surgeon will make 7 more cuts. These are the epidermis, subcutaneous fat, fascia, rectus abdominis, and peritoneum. Once the doctor has cut through these 5 layers, the uterus can be seen. Then the doctor cuts through the outer layers of the uterus. Then he makes a 10-centimeter incision in the muscle layer of the uterus. This incision is large enough for the baby to pass through. Finally, the doctor will open the amniotic sac inside the uterus and draw out some of the amniotic fluid that's left behind. Then the doctor goes deeper into the uterus to find the baby's head. The baby is removed through an incision in the uterus. After the removal, the doctor cuts the umbilical cord and the placenta. Finally, the baby is born. After the baby is born, the doctor will gently press on the uterus to remove any remaining placenta or other tissues. After that, a 1 to 2 hour suturing procedure begins. The suturing process involves sewing the 7 layers of tissue one by one from the inside out. Once the suturing is complete, the mother is moved to the recovery room for observation. But that's not the end of it. After the anesthesia wears off, the incision in the abdomen is the real pain.